Hello and welcome to webinar number 7. And today we will talk about cooperation in cases of domestic violence. And this is what we will do today concretely. So after a short introduction, I will explain to you the role or your key role as a medical professional in violence intervention. Then I will introduce to you the main actors in cases of domestic violence. Afterwards, we will get practical again with a case study that we have prepared for today. And by the end, we will talk about the effects of successful cooperation and again, a short question and answer round, as you already know from the last webinars. But first, let me introduce myself. My name is Olga Damsen and I'm a social worker. Together here with me is my colleague Marion Steffens. She is the founder of GESINE Intervention, the organization that we work for. GESINE Intervention is a center for prevention, information, protection and support in cases of gender-based violence against women. We are located in Germany, and part of our work is running a women's shelter, a women counseling center, a perpetrator program. Then we also have the GESINE campus, which is kind of a training offer. And we also work in the EU projects such as VIPROM. Let's dive into the topic. So I would like to start with a number. A recent study from Eurostat, where they have asked various women all across Europe, shows that more than 20% of women who have experienced violence have contacted a healthcare service or a social service provider because of the incident, which underlines again the important role that you play in the support chain of domestic violence victims. And when we think about the word support chain, you might think that it's a lot of work, that is a process that will start to run. And when you think about your everyday practice, you might think that working together and building up a cooperation sounds like an additional burden and additional work. But with this webinar, we would like to show you that on the contrary, it can be a great help for your work. And we would like to show you how and why. So let's imagine you have this female patient and she is coming frequently to your practice. Maybe she has been there already for the third or for the fourth time. And she's complaining about symptoms like frequent headaches, about tooth loss, chronic gastrointestinal symptoms. Maybe she also has gynecological issues, chronic somatization, and depression. And of course, your first priority as a medical professional is to check what's behind the symptoms. But since you have visited our webinar series and you know how to disclose domestic violence, you find out that there is more behind the symptoms and that you have the suspicion that there might be domestic violence. So after giving your patient medical treatment and maybe refer your patient to other specialists to clarify the symptoms like the gynecological issues, for example, you want to talk to your patient and because you're worried, of course, about the health situation. You know, you might give a relief right now with the symptoms that the victim has. But when the person stays with the violent partner, it might get worse. And you maybe ask your patient, why don't you just leave? And we want to raise awareness for the situation of a victim when he or she is thinking about leaving a violent partner. It can open a lot of questions and worries. There can be the question, where can I go? Like some people have relatives, family, friends where they can go when they leave the violent partner, but some are, they do not have the opportunity to go somewhere else. The victim might ask herself, how can I protect my children and what will happen to them? Should I inform the police and what happens if I do? Will anybody believe me anyway when I talk about the incidents? Where do I get financial support? And where do I get psychological support? So you can see there are already a lot of questions that can be very life-changing, but there can be even more. For example, the person might have a language barrier, which applies mostly to people with migration background. there can be a running asylum procedure and the fear of losing the resident status. This is actually something that is very realistic, for example, in German law, that the woman can lose her resident status when she leaves the violent partner. The person or the woman might be pregnant, and of course there is a general fear of losing the home. There might be even a physical or cognitive disability of the victim itself or of a child, and maybe also a dependence on a care person. So we see there's a lot of things to consider. So we always want to emphasize from the victim's perspective that opening up about the experienced violence and deciding to seek help might mean that their whole life might change. And then there is even more. 2 weeks ago, we have been talking about risk assessment. And there is a lot of research and also our daily experience here working with victims that shows that the risk of domestic homicide becomes highest during the period of separation. But why is it like this? So abusive relationships are generally about power and control. And the loss of the control when the victim decides to leave can lead to an escalation of violence to regain the old order or the old power hierarchy. So we always emphasize that leaving an abusive relationship is not a normal breakup. It can be very dangerous for the victim. So what to do? In case your patient considers leaving the violent partner, and you think about all the questions that we have shown the slides before, it is important for you to know that, of course, no one can provide answers to all these questions. For that, there are specialist services. Especially when you think about the safety planning. 2 weeks ago, you had this webinar from Rita, and she was talking to you about risk assessment safety planning. And maybe now you know how to do it, but then you think, when should you do it? Because time is usually short. And risk assessment and safety planning might take time and maybe several appointments. But the good news is that in your local network, you can find support services, and usually they know exactly what to do. So not only in regard to help you in your daily practice, but also in regard of the safety planning with the victim. Cooperation can not only support you as a medical professional, but it is also crucial for the victim. So who are the main actors in cases of domestic violence? Which type of support services in cases of domestic violence do you know in general, and who could help? So we would like you to make this exercise for a few minutes and just to think about the first support services that pop up into your mind, who could support in case of domestic violence. I will start reading some of the answers. A lot of you have mentioned police, violence protection centers, child protection, social workers, then anti-violence hotline, anti-violence center, violence protection centers, shelters for domestic violence victims, child welfare agencies, women shelters, again, police. Thank you so much. So some of you have already a good overview. You will find some of the things that you have mentioned here, and we have some more. So from our experience in working with domestic violence victims, we can, of course, confirm that the victim support services, like we are a big actor in this field as professionals regarding domestic violence, but also child support, like the Youth Welfare Center or Youth Welfare Office, and child advice centers. The police is an actor, of course, various housing services. A lawyer can be an important actor in cases of domestic violence. Asylum support services, as we have mentioned before, and psychological support, of course, and support services for disabled people, and other social services, for example, for financial support. So this is an overview about actors or of actors who can be involved or are often involved in cases of domestic violence. Of course, it always depends on an individual case. So there can be, of course, not always all actors are involved in the same case, and sometimes there are even more. It just depends on the personal situation. But let's get practical. So we have prepared a case study, the case of Tanya. And by using the case study, we would like to give an example or just to do a practical example how it can look like. And I will read the case study Tanya, and then we have a task. So Tanya is a 35-year-old woman with 2 children, 3 and 8 years old. Tanya works part-time. Her husband was always a jealous person, but since she gave birth to her second child, he became very controlling and abusive. When she got pregnant, he alleged that the child is from another man. Now, every time that they are going out, he blames her to be flirting with other men. Because of his behavior, Tanya became more and more isolated. Recently, after a birthday party, he started to accuse her again of flirting with other men. In this fight, he pushed her so hard that she fell and broke her wrist. In the outpatient clinic, she gets medical treatment. The doctor treating her speaks to her sensitively about possible violence. In that moment, all emotions burst out. She tells him that she is under chronic stress and the family situation is putting a strain on the children. The children notice that their father is getting loud with their mother. Due to the stress, the 8-year-old son has started wetting himself again. Tanya asks what she can do and where she can find help. So, our question is, what kind of institutions would you involve in the case of Tanya? We are curious to hear your answers. Okay, I would read some of the answers. Psychological help and support, medical evaluation, anti-violence center, possibly in cooperation with youth services, medical and psychological follow-up for both Tanya and the kids, anti-violence center contact, police involvement if Tanya agrees, victim support services was mentioned several times. There is information that there is a legal obligation for the medical staff to inform the child protection service about the family condition. Then again, child psychological help and anti-violence center, housing and psychological support, medical care and follow-up, pediatrics, children's protection service, psychologists, so a variety of answers. Police to get a restriction order against the husband, and so on. Okay, thank you so much. So when you read all the answers in the chat, my first thought is that's a lot of work to involve all of the institution, especially for you when you're working in a clinic and have not that much time to involve all of these institutions and care for Tanya. Our suggestion is, and maybe we are a bit biased, of course, as a victim support service, but the victim support service is always a good first address, and a lot of you have also mentioned it. These victim support services, it might be a women counseling center or a similar institution. They can clarify, together with Tanya, our case, questions that she might have, like, what do I need to know when I decide to leave? Where can I go? Which steps do I have to take? Maybe she will also ask, where do I get financial support? When we remember that she works part-time and she has 2 little children, there might be a financial burden if she leaves the husband. After she has the broken wrist, she might also ask herself if she should involve the police and file a complaint or not. And very important, of course, victim support services can do a proper risk assessment and a safety planning individualized to Tanya's case. This is very important again to mention and to follow up, as I already said on the webinar that you had 2 weeks ago, because risk assessment can take a lot of time. It might take the time for the victim to open up. It might take time to evaluate the whole life situation. So it's very good to make a short and brief risk assessment in the clinic itself, to know where to or how to help Tanya. But a proper risk assessment can take place in an institution like the support service, where they have time for several appointments to conduct a proper risk assessment and an individualized safety planning for Tanya. Of course, there she can also get psychological and social support. And some of you have also already guessed, the Youth Welfare Center is a very important institution when we remember the 8-year-old son of Tanya, who is really suffering from the situation. He is witnessing his father getting loud, and maybe he was witnessing the violence where Tanya got hurt, and he started to show symptoms. So the Youth Welfare Center is a good address where they can also make a risk assessment for children and maybe start with safety measures, and of course to offer psychological support. But it's not only about this. Also, Tanya can get support as a parent. She can get information on custody rights, for example, in case that she wants to leave. And she can get information as well about financial support. And of course, what to do with the kids and how to support them. So this would be our best practice in a case like Tanya. In the first step, it's very simple to refer to a support service, a local victim support service, and the Youth Welfare Center. Maybe you might ask now yourself, what about the police? So for us, it's always important to emphasize that reporting to the police can not only be scary for the victim, but it can also cause a lot of damage. Because our experience in working with victims shows that the most cases that are reported are dropped. If they are lucky, they have the medical documentation or some other kind of documentation, but still it's very difficult for the reported cases that they proceed further on. And when these cases are dropped, it can expose the victim to an even more dangerous situation or even financial problems. And there are also some additional factors. Some victims have maybe made negative experiences with police during the migration or fleeing process. And maybe there are even possible problematic structures within the police in your own country. This all can lead to re-traumatization, even if it's not the case that there are problematic structures, but still it can be for some people very re-traumatizing. We know a lot of women who had a fleeing process, very traumatic, like with a lot of trauma. And when they see uniformed people, for example, it's very difficult for them. So we always give the advice that before involving the police, that the victim gets a legal consultation through a specialized service so that they can evaluate together with the person how high are maybe the chances for a file, and maybe they will find out that the evidence is not enough, and then they can decide that, or the victim can decide not to go the process because maybe she will lose it anyway. It's very frustrating, we have to admit. It's not how it should be, and we are always pledging to hold the perpetrators accountable. But unless the laws are not changing in that way and making it easier for victims, we do not recommend it directly to involve the police. Moreover, it is very important to consider that once a case is reported to the police, they have to follow up on this, so they cannot take it back. It, of course, depends on your national law, but usually it is like this. So we have another small and last task for you, and you do not have to write it in the chat, just make a note for yourself. It's a short desk research, and I would ask you to search for your local victim support service in your town, in your county, maybe nationwide if you do not find something locally, but the more regional, the better. Where you could refer Tanya, for example, to. And I will give you another 5 minutes for this short self-assignment. Okay, so for some of you, it might have been easy to find something. For others, it was maybe difficult to find an appropriate victim support service. It's very depending on your local context, and even within a country, there might be a big difference between a city and a rural area. An important reminder, whenever you refer someone or you want to make an appointment maybe for the person, please always make sure that you have the victim's consent when you're involving a third party. And please always respect when the victim does not want to contact the police for reporting, or even says that she or he does not want to get in touch with the victim support service, even though it's a very low threshold support, but still some are just not ready to get an appointment and to seek help. So, the effects of successful cooperation. When we go back to one of the first slides and we think about all the questions that your patient has and all the dark clouds above the head, we can actually make it quite simple and quite easy. So here you can see some of the most important steps in this intervention chain. And when we have you as a medical professional here, your role is, of course, in the first step, very important to give your patient an appropriate medical treatment. And very important as well, as you have learned in webinar 4 or 5, I do not remember, to make a court-proof documentation, which will make it easier for the victim afterwards to decide whether she wants to go to the police or not with the evidence. And in a second step, to support when the victim wants this with a referral to a victim support service, for example, a counseling center. This can mean that you help your patient to make an appointment. This can mean that you hand out a flyer or write down a note with a number, anything that helps the victim and for what the victim gives you the consent. And when your patient arrives at the victim support service, for example, like in this case, they can do all the other steps and clarify all these other questions that we have seen here. So, as we have mentioned already, the legal advice, maybe the contact with the police, a referral to child support services, and other services, financial services, and of course to give the victim time to proceed with what happened, which is a very important step when we think about all the physical symptoms that your patient has. It helps a lot to get this psychological support, to talk about what happened, and yeah, therefore to reduce also possibly physical symptoms. A short reminder or attention, and we have already also read it in the comments. So in Germany, there is a legal obligation to inform the Youth Welfare Office whenever you suspect child endangerment. And please check it always in your country. For sure, you also know it in case that there is some evidence from your small patients. But as we have seen in the case of Tanya, there might be also the psychological effects when they witness violence. They do not always have to experience physical violence themselves, but it can be also something different. I would like to show you a short video on how this kind of safety planning and also psychological counseling can look like from the side of the victim support services.
So Lara, I know you've already spoken with our intake team on the phone and your GP sent through some information with the referral. And I believe my colleague, Amy, started a risk assessment and a safety plan with you and explained a bit about all this.
Yeah, that's right.
Yes, so today I'm hoping that we can just keep talking about what's happening for you, build on the risk assessment, and talk through how we might support you and your son Robbie just to feel safer. And I'm not going to ask you to repeat anything you've already said. Do you feel up to that today?
Okay, I can do that.
Could you please let us know that you're worried? Andrew's behaviour's been getting worse recently. Can you tell me what he's been doing?
Well, I mean, he's been like this for years. It's just so much worse since his work made him redundant a month ago. No, he's always put Robbie and I down. He's always called me useless. But now it's relentless, and he just nitpicks over everything.
Well, that sounds exhausting. And there is never an excuse for anyone to treat you like Andrew is. Can I ask you what his nitpicking looks like?
You know, one day he wants something done this way, and the next he's changed his mind. It's my fault I didn't get it right. I can't win. You know, he's obsessed with money. A few weeks ago, he got angry at me because I spent too much on ham. And then last week, I bought the home brand. And he's just shouting at me, saying, I can't eat this crap. He blames me, says I should know better. I can't win. But I can't argue with him. I know what he'll do.
Well, that sounds confusing and upsetting, that he's blaming you for his behaviour. What are you worried he'll do?
I just know from what he used to be like where this is going. The last time he was like this, I was pregnant. It was terrible. He just used to explode, like physically, hitting me all the time. I just feel like that's going to start again.
Are you worried that he might be physically abusive again?
I mean, I could be wrong. Maybe I'm being unfair.
Lara, you know your own experience. And I believe you when you say you know where this is going. So I take your concerns really seriously. How safe do you feel to leave here today?
Yeah, okay, for right now. I'd go if it got that bad. And we're managing until I figure out what to do next. For Robbie, though, he's not going well.
Tell me what's happening for Robbie.
He's doing year 12. He's just so down. Barely leaves his room except for school. Andrew's been at him, constantly putting him down, telling him he'll never amount to anything.
You are doing so well reaching out to get help for the both of you. I'd like to ask some more questions about what's happening for Robbie, though. Is that okay?
Yeah, I'm mainly here for him. He can't keep going through this.
And I want to make sure that you and Robbie get the right support. So, as well as me asking you questions, it might be a good idea for us or someone who's supporting Robbie to chat with him about what's happening as well. Your GP told us that Andrew has taken away your medication in the past. Do you feel up to talking about that?
Yeah, that's okay to talk about. It's not recently he's done that, but before. If I didn't do what he wanted a few times, he's locked it away.
I'm really sorry to hear he did that to you. How did that affect you?
I've got bipolar disorder.
Okay.
First there's the withdrawals, and then once I became manic, he'd call Kat. I couldn't tell them what had happened. I knew what he'd do. And he was telling people. He called me crazy.
Oh, Lara, that sounds terrible. Not only how unwell that made you, but because you couldn't get the support you needed with the family violence.
I felt crap. I told no one. I knew no one would believe me. In everyone's mind, I'm the one with issues. It wasn't until I started seeing this new doctor that I really said anything at all.
There are some serious stereotypes happening here that he's used against you. Are you concerned he might do this again?
It's crossed my mind. With how bad he's getting, it wouldn't surprise me.
I can hear that things are getting worse, and I'm really glad you're here talking with us about it. There are a number of factors that indicate to me that the risk to you and Robbie is serious. So I want to spend some time talking through that and what it means. Is that okay? Yeah.
So I think it is a good example on how that kind of counseling can look like from the side of a support organization, and how also the trauma-sensitive language can be used. But let's wrap it up a little bit and talk about some challenges and chances, because of course both exist. Starting with the challenges. The infrastructure is, of course, different in each country. So what works for us in Germany might not work in France or in another country. For example, in Germany, we have victim protection officers from the police. And depending, of course, on the region, on the county, there might be a very good cooperation with them. In some other regions, it's not working very well, but in case there is a good cooperation, usually it helps the victim support services a lot, for sure. But of course, what works in a big city is maybe not working in a rural area. This is also an experience that we have, because our organization is in a very in a big but very rural area with some small cities and villages, and the infrastructure and building up cooperation works different than in a big city like Berlin or Munich, for example. And another challenge is that maintaining and even before building up a good cooperation usually depends on engaged individuals in your clinic. But of course, there are also chances. So first, from a medical perspective, there is always the big benefit after disclosing violence that you have an explanation for previously unexplainable symptoms, which makes it, of course, easier to think about a proper treatment and to improve your patient's health. Moreover, when we think about psychological consultation and all the help that the victim can get from being referred to a specialist service, when you think about all the symptoms that the victim had before in this stuck situation, there can be an improvement of the health after getting psychological support and maybe support to leave the violent partner. And yeah, with all of this, you can make a crucial contribution against violence and the safety of the patient. So we have some very basic steps, actually. The first step, and you have maybe already done it with your little desk research, is to find out who can be your local ally, which institution exists in your local network, what kind of person is maybe a good spokesperson to build up the cooperation. And another useful tip is to find an ally inside of your own institution, in your clinic, with whom you can talk about domestic violence cases and who can support you in building up the cooperation, but also in proceeding with the cooperation so that there is more sustainability. And yeah, the good news is that sometimes one good working contact is already sufficient. So you do not have to build cooperation with 10 institutions, but when you have your one good working contact and they can support you and refer to other services, it can be very helpful for you. Yeah, we also recommend to check the handout because we have there collected some more practical tips, for example, where you can look for your local women support service and how to find, for example, a search engine for a women's shelter and some more tips. So we encourage you highly to check our handout, which will be uploaded again in the participant area like all the other handouts.